topic here. SDD is a physiological disorder where clients have significant, unexplained physical symptoms. For example, abdominal pain, weakness, chest pain, shortness of breath, and others that result in debilitation and distress, which disrupts daily life. Now, the big key point and the weird part is there is no medical cause of the physical symptoms. All tests come back negative. These physical symptoms are real, and the client's not just making this up or faking it. So the causes here is that SDD is thought to be caused by periods of extreme stress, like work stressors, death of a family member, problems in a relationship, or financial stressors, among others. So clients will often obsessively focus their time and energy on the symptoms, which causes more pain, and going to many different doctors and practitioners in order to get a medical diagnosis. And really the hard part about this whole thing is that this medical diagnosis doesn't exist. All this pain and physical symptoms are really just caused by the patient's stress. So in terms of interventions, it always revolves around limiting focus on being sick, which can be a source of obsession for the client. So the key terms to write down is limit the time discussing physical symptoms. Huge NCLEX tip. And always give further education when the client is looking for yet another provider or another doctor to go to diagnose these symptoms. No doctor hopping, rather limit the time focusing on the symptoms here. And number 2 is we want to promote insight by identifying the stressors that intensify the symptoms. And number 3, coping mechanisms, stress reducing techniques. Usually the top tested are deep breathing, meditation, and exercise. Now, don't let the NCLEX or exams trick you. We do not reinforce negative exam results when the client wants pain meds. Remember, the symptoms are real here. Never debunk or dispute the client's symptoms saying they're not real. And don't get tricked by advocating for the client for more diagnostic tests or even a new diet, since this is a psychological disorder and there's no medical cause here. So remember, the goal here is to limit the focus on the symptoms here in order to limit the obsession and decrease those stress levels and ultimately eliminate the symptoms entirely. All right, that wraps it up. Thank you.